Welcome to the series, Vitamins for Whole Health. Short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about riboflavin, or B2. What is vitamin B2? It is a water-soluble molecule also called, again, riboflavin. Water-soluble simply means that it mixes easily in water, though not in fats. If you've ever taken a B-complex vitamin and noted its yellow color, it is the vividly yellow riboflavin that imparts that color on the whole. What does riboflavin do? Well, it pairs with the body's enzymes to grow cells, to produce energy, and to break down compounds like fats, steroid hormones, and certain medications as well. Now, the benefits of adequate riboflavin are as follows. There's cataract protection. Studies show a tremendous benefit against cataracts and the development of same. It boosts glutathione, which is the body's #1 antioxidant produced endogenously within your own tissues. It shows reduced risk of cancer and heart disease. Now, some genotypes, some people with certain genetics that is, may experience more benefit than others. And of course, lower incidence of migraine also shown to be a benefit of having adequate riboflavin, as well as lower risk of multiple sclerosis. Now, what does a riboflavin deficiency look like? Well, cracked lips, especially at the corners of the mouth. You want to know how I got these scars? Yes, riboflavin deficiency. Swollen tongue, hair loss, anemia, itchy red eyes, and in severe cases, again, cataracts. So how much do you need? Well, if you're a man, the recommended daily allowance is 1.3 milligrams per day. Recommended daily allowance for women is 1.1 milligrams per day. As for food sources, riboflavin's in a variety, although mostly animal-based. Dairy, eggs, organ meats, muscle meats as well, and these could come from chicken, cow, pig, even fish. Almonds are a good vegan source of riboflavin, as well as spinach and fortified grains where the riboflavin has been added in the fortification process. Obstacles to getting enough include, believe it or not, light. Too much light destroys riboflavin. So when you buy that milk in the jug, if it's been sitting there under that light for too long, that riboflavin that it has in it, could be zapped right out. So if you're buying your milk in an opaque plastic or other container instead of something clear, you're going to have preserved more riboflavin. For those that are pregnant and using more riboflavin for the development of new life, yes, that can induce riboflavin deficiency and make it harder to get enough. And of course, veganism and vegetarianism puts one at risk because the main sources of riboflavin are, again, those animal foods. So again, who is at risk? Well, those suffering from alcoholism because of that liver issue we mentioned in the thiamine lecture as well. Vegans and vegetarians, as already said, and pregnant women around us. Now, as far as riboflavin toxicity, I'm pleased to tell you that as a water-soluble vitamin, there is none. Washes right out in the urine. Good thing, unless you're Emily. Quick story from my college days. When I was completing my clinical rotations as a young, almost dietitian, I had a classmate, again we'll call her Emily. I came into the office one day in the hospital that we were rotating at, and Emily was looking at the screen upon which was displayed the question on Google, what does green urine mean? So I asked her, Emily, why are you Googling green urine? And she said, oh, Thomas, it's terrible. I was hoping that I would get through with this search before you got here. I've already talked to the other dietitians. Nobody can exactly figure out what's going on with me, but it's true. I woke up this morning and my urine was green. So I said, well, I'm no expert, but I did go to kindergarten. Tell me the answers to a few things. Number one, have you had any medications recently with any kind of blue dye in them? Yeah, last night I took whatever it was, an Advil or something. That was blue. Okay. What about vitamins? Do you take any vitamins, anything with, say, B complex or even just riboflavin in it? Well, yeah, I take a B complex every day. Oh, okay. Well, again, I went to kindergarten, And I know the blue from that Advil and the yellow from that riboflavin in your urine is going to make green. Do you think that could be what happened? Sure enough, that's exactly what happened. Turns out it's pretty hard to get green urine, but it can be done with a little help from riboflavin. Thank you for watching the riboflavin lesson in the series, Vitamins for Whole Health. We'll see you around.